Hi, my name's Charlotte Haigh. I'm a health journalist and I'm here to talk about cardiovascular disease. It's one of the UK's biggest killers. It affects 7 million people in the UK, with numbers of men and women equally impacted. Cardiovascular disease is a term that covers any condition affecting the heart and blood vessels, including coronary heart disease, heart attack and stroke. The NHS spends about 9 million a year on treatments for cardiovascular disease, with doctors prescribing drugs including statins and medication to lower blood pressure. But I'm here today to talk about a different approach with Dr. Weiss, a leading US cardiologist and naturopathic physician. So Decker, you're a cardiologist and naturopathic physician. Can you explain a bit about that approach?
So I trained there. I did internship, residency, and fellowship in the Columbia system and in Arizona Heart Hospital and Institute. And then I stayed on staff of the hospital for over 10 years as a cardiologist. So it was really nice. And I think it's different because I went to a naturopathic medical school, so my first instinct is natural. I think it's hard when medical doctors will go back and get natural medicine training. I think that's very hard to do. If your instinct is, well, we'll use the med first. I look at pharmacology as alternative medicine.
Gosh, that's really interesting. So what is the most heart-healthy diet and lifestyle? You mentioned a few things there, but what would you say to people wanting to look after their cardiovascular system?
The diet's fairly easy. It's a Mediterranean diet. The Mediterranean diet will always be the most heart-healthy diet because we have years of studies on populations in Greece and Italy and things like that. And what is, healthy oils, those dark leafy greens, those beautiful berries, all of those types of things that you get there. So lifestyle comes in two pieces. And what you want to do is individualize your life. One of the flaws of all medicine is we tend to treat it as a herd. That doesn't work well. When you want to prevent, it's got to be on an individual basis. And so the first thing is finding your inflammation, okay? Some of it's easy, and we kind of call it loud inflammation. Loud inflammation, my elbow hurts, okay? I have, chronic skin problems. I have gas and bloating, diarrhea, whatever it is. Find your loud inflammation, walk into a health food store, and start working on it. It'll be a process. Natural medicine, I tried this, now I tried this, now I tried this, a little better from this, oh, okay, and then all of a sudden it all gets better, okay? So finding that is. Now with loud inflammation, you always need to include three things that we don't tend to think of. Insomnia, fatigue, and depression. These are inflammatory conditions. They are measurable and reversible. And you have to go into an anti-inflammatory lifestyle and use certain supplementation, and over time, couple weeks, couple months, you can repair these things. But we don't think fatigue is an inflammatory issue, but it absolutely is. It's the suppression of neurotransmitters due to all the inflammation, and then you can't sleep and you're tired all the time. And that's what you want to add to that. And we don't think of it, we like to separate that out. When you look at insomnia, for example, what do people take? They take Tylenol PM. It's an anti-inflammatory, antihistamine. So why not use curcumins, and why not use good magnesiums and torates in order to bring GABA levels up in order to do that. 5-HTP, bring your serotonin up to sleep, and then washes out and you start your day. And you can't reverse heart disease in a pharmaceutical model. You can only temporarily open arteries with stents and bypass. And there is a place for bypass. I'm not a big fan of stents in general. I think there's a limited place for stents. The data's just not good. I'd rather do natural models with them. But if people aren't going to change their diets, then go have stents. That's why we have a variety in the world.
Thanks very much, Decker. That was absolutely fascinating.
It's my honor, and thank you as well.